Hello, my name is Courtney Spees and I'll be doing the nephrotic syndrome case study today. We have a 4-year-old who has been admitted to the hospital. So the first thing that I'm going to do is walk in and introduce myself. Hi, my name is Courtney. I'll be your nurse today. I'm going to go ahead and do a QSIN as soon as I walk in. So I'll be looking at the patient's position, how many side rails are up, if he has his call light, if he has his side table in reach. I'm going to also be making sure that his bed is lowered to the floor and that he has the wheels locked on the bed. And also I'll be looking at his pathways, making sure they're clear, which I mean he's 4, so his parents are in the room with them. I'll also be noting if he has any oxygen on, any IVs, which he does in his left forearm. I'm also going to be looking for any drains, tubes, anything like that, suctioning, anything. So after we're done with that, we're going to go ahead and, like I said, introduce ourselves. So hi, my name is Courtney. I'll be your RN today. I'm also going to introduce myself to his parents since they are in the room with him. I'm also going to ask him his name and his date of birth, and then I'm going to confirm that with the parents and then confirm that to his chart before I do anything. And so the first thing I'm going to do is ask you, do you know what day it is? Do you know where you are? And do you know why you're here? And after he answers all those questions, I'm going to go ahead and start my assessment. So the first thing I'm going to do is do Perla. So I have my light here. Okay, so we did Perla is 3 millimeters. I'm going to go ahead and have him turn his head to both sides and check for JVD. Nothing is noted. I'm going to go ahead and take a look at his skin. It is warm, dry, and pink, and intact. I'm also going to, I'm just going to move this over here a little bit. I'm also going to ask him to wiggle his fingers. He can do that. I'm going to go ahead and check both pulses bilaterally. They're bounding, and other than that, they're just regular. They're pretty strong. I'm going to have you wiggle your fingers for me, and then I'm going to check cap refill on each finger. I'm going to go ahead and also inspect his abdomen area and his chest, looking to make sure there's no like bruising, open areas, anything like that. I'm going to go ahead and listen to him. Take a deep breath for me, or till my stethoscope touches your chest, please. Alright, I'm going to have you sit up on the edge of the bed. Alrighty, and then I'm going to have you lift your right arm for me. Your left arm. And then I'm just turning him around to show you what I'm doing here. I'm going to place my hands like this, have him take a deep breath to do ventilatory depth and make sure that his chest is rising and falling at the same rate. So everything was clear there. He had some diminished lung sounds, little crackles on his left lower lobes, anteriorly and posteriorly. Since he is 4 years old, before I would listen to him, I'd let him at least touch my stethoscope or explain to him what it's doing. Just explain to him what I'm doing. That way he doesn't get frightened. Even maybe get a teddy bear, which I mean, he is a teddy bear, so, but get a teddy bear and show him what I'm going to do just because he is 4. Making sure mom and dad are in the room, making him feel safe. So the next thing I'm going to do is go ahead and do his abdominal assessment. Oh yeah, also has he had a cough today? Is your throat sore, anything like that? No, okay. So the next thing I'm going to do is an abdominal assessment. Have you been having any stomach problems? Mom and dad, has he been going to the bathroom okay? Just questions like that. So the first thing I'm going to do is inspect his abdomen. The next thing I'm going to do is auscultate. So I'm going to listen to all 4 quadrants. Vowel sounds are active in all 4 quadrants. The next thing I'm going to do is palpate. Just let me know if this hurts. No. Okay, so have you ever had any pain during urination or any discharge, anything like that? Okay, no. Like I said, most of these questions can be answered by his parents also. So we're going to go ahead and look down here. I'm going to have you wiggle your toes for me. Okay. One thing I forgot to do on his upper extremities is push-pull. So those were positive. I'm going to have him push-pull down here for me too. Like I said, I had to wiggle his toes. He has some edema, about +1 non-pitting on all extremities bilaterally. So I'm going to go ahead and check his cap refill down here. Still less than 3 seconds, but like I said, edema is noted. Are you having any pain, any paresthesia, so like numbness, tingling? Can you feel me down here? Good, good, good. Other than that, I would check his pedal pulses now, which those are the same. They're present but bounding. So yes, that's about it. So the next thing I would do is check the orders. I'm going to be giving labetalol. I'm doing 0.5 milligrams per kilogram, which would be coming out to 1.8 milligrams per milliliter. So we're going to do an IV push for that. So the first thing that I would do is ask his parents to confirm that he has no known drug allergies. And I'm going to go ahead and check the doctor's orders, making sure that I'm giving it to the right patient at the right time, giving him the right drug, the right route. And then also I'm going to check that I'm giving it for the right reason. So I am giving it for the right reason. And then I'm going to also afterwards make sure that he has the right response to the medication that I'm wanting. So the first thing that I'm going to go over with the parents and the patient is do a little bit of teaching. So I'm going to go ahead and push this for 2 minutes. So I'll be in here just for a second. We're going to be monitoring his blood pressure and pulse when we're giving this and afterwards. If he wants to get up, just be careful because sometimes they can experience orthostatic hypotension with this. I don't want him to fall. We'll be monitoring his I&Os, and then we're also going to be monitoring for fluid overload because he is having the edema. Some side effects of this are arrhythmias, bradycardia, CHF, and pulmonary edema. So I would just make sure that the parents know that we're going to monitor him to make sure that he's safe and that we get the expected outcome of the medication that we're wanting. It's going to go ahead and help with his heart rate. It's helping with pulling that fluid off as well. So this is an antihypertensive medication. So we want that pressure to be pulled down. The doctor also would probably be prescribing some kind of loop diuretic, an ACE inhibitor, a statin, a steroid, or immunosuppressive drug. Like I said, we want to bring his blood pressure down, but we also want to make sure that he doesn't go into fluid overload or fluid deficit. So we would also be placing a hat in the toilet or giving them a pediatric cup or bringing in a scale if he does wear pull-ups. We'd also be making sure that we bring in a scale to monitor his weight, and we're going to make sure that we're monitoring his intake as well. So after I did all that education to the parents, I'm going to make sure that I am also explaining to them that his treatment plan is going to be working when the edema and fluid retention subsides, and we'll also be monitoring his albumin, creatinine, and BUN levels to see if there's any improvement in his kidney function. We will be providing frequent oral hygiene to reduce dryness in his mouth and mucous membranes. We're going to also be making sure that we're monitoring his respiratory status due to him having edema and excess fluid right now. We're also going to make sure that he is maintaining a low sodium diet, and make sure that we're watching his fluid intake, so he might have a fluid restriction while he's still edematous. And I said a snack that we could offer him would be some fruit and cottage cheese because he is 4. So we're going to go ahead and give this med now, since I provided all the patient education and I educated the parents. So the first thing I'm going to do is, like I said, check for allergies. I'm going to get consent. I'm going to check the MAR, check the orders, doing my patient checks and my medication administration checks. I'm also going to, after I give the education, I'm going to go ahead and wash my hands. I'm going to prepare the med. So like I said, I'm giving 1.8 milligrams per, or I'm giving 0.5, I'm giving 1.8 milligrams, yeah. 1.8 milligrams. So the first thing I'm going to do, like I said, wash my hands, get gloves on. I'm going to take an alcohol prep pad. I'll be drawing this up. So I'm going to go ahead and wipe the top of this off. Wipe, 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 wipe. I'm going to carefully uncap my needle. I'm going to pull up the amount that I'm wanting. So I got 1.8 here. I'm going to carefully flip the vial upside down. Inject into the port. Inject air. And pull that med up. Till I get about 1 point. All right. I'm gonna flick any air out. Make sure there's no air bubbles. So since I'm doing an IV push, this is a needleless system, so I'm actually going to, I'd recap my needle by scooping it, scoop, and then twist the hub off. So I have my med here now. I'm going to also make sure that I have some alcohol prep pads with me. I have a flush. And yeah. So now what I'm going to do is, before I do anything, I'm going to go ahead and make sure that his IV is patent. So I'm going to flush the saline lock, making sure that we don't have any swelling, pain, anything like that around the IV site, that nothing's leaking out. So yeah, I'm just going to go ahead and do that. So I'm flushing. Before I do that, I'd also alcohol prep pad the IV site, so IV site, and then flush. So now that we've done that and the IV is patent, I'm going to have, with my gloves on, going to go ahead and have the port closest to the patient. So it'd be this port. I'm going to go ahead and alcohol prep pad that off, making sure I'm doing that really well. And then, you know what, just be safe too, I'm going to go ahead and alcohol prep pad my syringe. So like I said, I'm going to go ahead and push this medication slowly over 2 minutes. So I'm going to connect this to the hub. Woo! Yep, connect that to the hub. And then, so I'm pushing, 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 over 2 minutes. I'm going to make sure to monitor his blood pressure and his heart rate during the entire initiation of the drug, and then I'm going to also come back in a half hour and check his vital signs again and monitor and see how he's doing. And obviously, I didn't just do that. Obviously, this IV is already primed as well and open. So after that, I'm just going to put that in the sharps and recap my IV, make sure everything's clean, and then I'm going to flush that once again. So alcohol prep padding this, alcohol prep padding this, connecting. So I flushed before. Well, there it is. I flushed before and I'm going to flush again. So flushing, 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 flushing. Okie doke. And like I said, I make sure I put some kind of like cap on the hub so that way it is maintaining as clean as possible. So after that, like I said, I've already done the patient education, so I chart how much drug I pushed, what I used to flush with, which IV site. So that was on his left antecubital spot. I'd also chart how he tolerated it. I would chart his vital signs when I gave the drug. And then I'd also make sure that I'm charting that I confirmed with parents that he had no drug allergies. I'd also chart how long I pushed the med. So I pushed it for 2 minutes. I chart what time I gave it, the route I gave it. So I gave it via IV push. And then I'd also make sure that I'm charting when I'm checking back to follow up, because like I said, that last step is making sure that we're getting the right response that we want from this drug. So I need to make sure that it's A, working, and B, making sure that the patient's tolerating it well. We don't want his blood pressure to drop or anything. That'd be horrible. So, yes, I think that's about it for that. So for report off, I would explain that this little 4-year-old came in. He had ascites and swollen legs and arms, so he has edema and he has ascites. So make sure to measure his abdomen girth as well, making sure that that's not getting bigger. I left a pediatric cup in his bathroom. I put a scale in his room to do daily weight with, and I also left some compression stockings in there if you can get him to wear them, or an STD or something like that. So I went ahead and took his vital signs, and he had some hypertension. We went ahead and put him on a low sodium, low fat fluid restriction as well. We went ahead and gave him labetalol. I administered 1.8 milligrams IV push through his left IV, placed in his antecubital area. I just used normal saline to administer that with, and then so we're hoping that he gets an order for some kind of diuretic, an ACE inhibitor, statin steroid, something like that, just to help A, make sure he doesn't get any infections, and B, pull that fluid off. We're wanting to also be monitoring his weight and INO, like I said, limiting the sodium fluid. I gave him that labetalol at 9 in the morning. He tolerated it pretty well. Make sure that we're also emphasizing his respiratory status during our head to toes, because he had some diminished lung sounds. I don't want him to have fluid overload, and that compromises his respiratory system as well. Make sure we're providing frequent oral hygiene. I also have not gotten back the lab results, but they are monitoring his albumin, his creatinine, and BUN levels to see if the therapy is improving his kidney function. So I gave the parents some education about the labetalol and all the interventions that we're putting in place to help their son. I also charted that his parents gave us consent to treat, and that his parents also confirmed that he had no allergies. So that is about it. He's in bed right now with 2 side rails up. He has his call light. So yeah, that's about it.